New details, it of course is that time of year where you don't have to go very far to find someone with a cold or some kind of sickness as we head into wintertime. When it comes to your children though, can you tell if it's something perhaps a little bit more serious? KWW reporter Colin Dorsey joins us now tonight live after learning about what to be looking out for this time of year.
Well, there are really three main childhood illnesses this time of year that can cause a cough: RSV, the croup, and whooping cough. All three of these are highly contagious and, with the exception of whooping cough, are fairly common among young children.
Just a cold to you or I,
Yeah.
which they're miserable anyway, but you know, an infant, it can be devastating.
How familiar are you with coughs? Respiratory therapist Tom Graham knows them pretty well. Nearly every child under the age of 2 will come in contact with RSV. For adults, it's not so serious and will pass mostly unnoticed. For children, it can be a bit more severe.
It's more like a cold to us, but you know, you remember that children are obligate nose breathers. So when their nose gets plugged, it gets hard for them to breathe.
He says RSV and the croup can typically be treated at home, but if the symptoms worsen, you should seek help.
You know, usually it passes on its own, but you know, things you look out for are blueness around the lips, trouble breathing. A lot of times you'll see their ribs when they're trying to pull in air, coughing.
The scary factor of the croup is really the sound.
As a parent, you're sitting there, you're listening to your kid cough, and it's a barky seal sound. And you know, they get the stridorous, musical noise when they breathe in. You know, it's usually worse onset at night.
But what about that old treatment of cold air for a croupy cough?
It's not medically based, but yeah, cool air does tend to alleviate that swelling in the upper airway.
Gotcha.
So some parents, they'll rush their child to the ER, and then they hit the cold air, and when they get here, you know, it's not as bad.
Now, he says whooping cough is the most easily prevented since there is a vaccine. It's included in the Tdap and DTaP shots you get as a child. Whooping cough is characterized by its whooping sound when a child tries to inhale following a coughing fit. Ron?
All right, Colin, hey, thank you very much. You know, whooping cough can also last quite a long time compared to other illnesses, sometimes weeks or even months, depending on its overall severity. RSV and the croup will often pass, though, in just a few days, luckily.